surgery with Dr. Igor Chaplik, and today we're going to be talking about fillers. So, Dr. Chaplik, thank you for being here.
Thanks for having me.
And let's just go ahead and start right at the top. So, you've been seeing patients and treating patients with fillers and injectables for how long?
15 years now.
Okay, that's a long time. What are some of the most common reasons that people come to you for fillers?
That's a good question. I like to break down the reasons people or patients come in for filler based on their age groups. Typically, some of the younger patients just need a little refresher to augment certain features about them that are already good.
Sure.
So in the younger ages, 20s to 30s, sometimes they can appear tired, and so we can put filler under the eyes, or they want their already nice lips to look a little bit more lush or a little bit more plump. So we can put in a little bit of product into the lips, and then sometimes to augment nice cheekbones, or make them look a little bit more sharp or a little bit more puffy. It depends on what the patient's trying to accomplish.
Mm-hmm.
We can do that also.
Okay.
And then, as we get into the 30s, 40s, 50s, and 60s, it really depends on how the face is aging, which filler we pick and what we do.
Okay, so it sounds like it's a combination of age and then also wanting to harmonize, balance, give symmetry, and you're talking a lot about proportion.
Proportion is always important. Symmetry is the most important as it relates to filler and filler procedures. So when I approach a patient, I first look at symmetry, and I make sure that whatever it is that we pick, I always try to harmonize the face and make it symmetrical. Then secondly is volume loss. It really depends on the age group of the patient and the deficit that the patient has. Sometimes by sleeping on one side, you would need to put more product on that side, and vice versa.
A lot of people think that fillers are meant to solve the problem of gravity. Is gravity truly the problem, or what is it that you are trying to correct as we talk about that natural process of aging?
That's a good question. I mean, people or patients or the media or whoever says the word gravity because things start to droop, and so
it's an easy culprit.
It's an easy culprit, but reality is that as we age, we lose fat, muscle, and bone.
Okay.
And so really what winds up happening is we age by losing the fat in our mid-face and deeper fat compartments, and we also start to lose muscle as we get older, and we start to lose bone. Women in particular, as they get older, lose bone and bone mass, and so it's very important to supplement calcium and things of that nature. But it also goes to show that not only do we lose bone in our skeletal body, we lose bone in our facial body too, and that's
Makes
sometimes
sense.
the reason that women, for the most part, in the same age as men, appear to be older sometimes. They lose, unfortunately, more bone than men do sometimes.
That makes sense. All right, one of life's cruel jokes. These are safe products, but do they come with some risks?
All fillers come with risks. When we first started doing fillers, we didn't really know much about the risks associated with them, but now I think in today's day and age, if you're getting a filler procedure, you should know that there are a lot of serious risks to fillers. There's
Sure.
vascular occlusion. You can necrose skin, meaning if you occlude an artery that supplies the skin, you can actually lose that skin. It's quite dangerous. And then the most complicated and scary filler complication is blindness. If you can occlude a retinal artery, a patient can go blind. So
it sounds like this is something that a board-certified dermatologist, plastic surgeon, trained physician should really be doing.
In general, the core physicians are plastic surgeons, oculoplastic surgeons, ENTs, dermatologists. Those are the physicians more versed in facial anatomy and more versed in filler technique, and also most of those are the core physicians that do the studies on these fillers.
Okay.
And so in our societies, in our textbooks, and also in our journals, we are more educated as far as not only how to inject, how to analyze an aging face, but also how to potentially reverse a filler complication.
Okay. Now, let me ask you probably the most important question that I'm going to ask. With your 15 years of experience, why would you expect a patient to come to you as opposed to, just next door? Or what is unique about your technique, your approach, and your knowledge of fillers and injectables?
That's a good question. I think, really I can't answer that because every doctor, every injector, every physician is different.
Right.
I have developed my own technique by training with some of the world leaders in filler and aesthetic medicine in general. And so my technique is different than the guy next door. And so it's basically preference and getting a rapport with your physician, getting a trust. And so usually with my consultations, I'm very direct with the patient. I tell the patient what I'm capable of. And then if I'm not capable, I'll tell the patient, I'll say, look, you're asking for something that's going to require surgery and I don't do surgery, or you're going to require something that needs laser, or this will require something else. But the beauty of my practice is that for the most part, shorter facelifts and blephs, I do everything else. So if I can't correct the problem or address it with filler, then I'll tell the patient, well, I have something else for that. There's Accutite, there's Morpheus, there's CO2 laser. So there's a lot of different ways to address a certain problem, but the most important thing to do is to explain to the patient what you're capable of, and also know yourself what you're capable of.
So it sounds like setting the right expectations and being transparent and honest with your patients. That's definitely a core principle here, very apparent. And then finally, having a myriad of solutions, having a few different solutions to pick from, whether it's different devices to use in combination with fillers, different fillers to use, and clinical experience with those fillers, all at your fingertips.
You put it better than I did. Thank you.
I try. So, are there any closing statements that you'd like to make before?
No, I'm just happy to be able to present my technique or my advice on filler, and how to try to pick the right physician for you, try to get an understanding and a trust, and maybe see some before and afters from your doctor.
Yep.
And try to go to a core provider, somebody who's an ENT, oculoplastic, plastic surgeon, dermatologist, and do your research and see what it is that the doctor is saying. You don't necessarily have to do the procedure that day. Try to see some other doctors, get a comfort level, because ideally the person or the doctor that you go to is the person or the doctor that you go to forever. And so once you get that once you get that comfort, and the results are good, I personally would go to that same provider, because you know that they're going to reproduce those results. Right. And so I think it's important to do your homework off the bat, but once you find somebody good, stick with them.
And be consistent.
I think so.
All right, so you don't end up with a Picasso face, right? That's what we call it, or that's what I call it. All right, so timeless advice. Thank you so much for your time, and we hope to see you here at Aesthetics.
Thanks for having me.